Hey guys, I'm Dr. Norian. I'm a double board certified fertility specialist, a reproductive endocrinologist. I work at HRC Fertility, and I'm based here in Southern California in the greater Los Angeles area. So what I wanted to do today was to spend some time, say 10-15 minutes, just talking about COVID-19, talking about this novel coronavirus. And to be fair, the word novel is what's making us all a little more cautious and a little more, on edge. So what is COVID-19? So COVID-19 is a novel virus. It's new, meaning that we haven't seen this before. We haven't been exposed to it. It's an RNA virus. Other coronaviruses are SARS, MERS. Back in the old days, the coronaviruses were really not that big a deal. But what has started to happen is they've started to become more virulent, more strong, I guess you might say. So that's why we're all taking this extremely seriously and having a big abundance of caution. So for the next few minutes, let's talk fertility. Let's talk about embryo transfers. Let's talk about, should I freeze my eggs? Should I freeze my embryos? Let's talk about when I'm pregnant, what are some things that I should be cautious about? Also, if I am pregnant and I have COVID, what do I need to know? So let's start there. So what we know so far about coronaviruses is, with the limited information, that coronaviruses don't transmit vertically. So there's less vertical transmission. The rate of vertical transmission from mom to fetus or gestational carrier to fetus in coronaviruses has been extremely low to date. So that's good. Whew. So the likelihood that the fetus or the baby, the future baby, will get the disease is going to be lower from what we know from prior coronaviruses. Now, if I am pregnant and I get COVID-19, is that bad? So it's not great. That's part of the reason why we recommend all this prevention stuff that we're going to talk about at the end, and I'm sure a lot of you have heard about already. But we know that from prior viruses and also the reported pregnancies, remember this is a lot of limited data for pregnant patients with COVID-19, that they're at risk for severe respiratory problems. So bad breathing problems, and other sequelae that can really impact lots of different organ systems. So, and we've known this for years. Also, please understand that we don't want our pregnant moms or gestational carriers to get severe asthma attacks or to get severe pneumonias. Remember, that's not great anyways. So in the women who had, and remember I'm working with limited data, SARS and MERS, right? Those are two other coronaviruses. Their outcomes, they had higher risk pregnancies with higher risk outcomes. Preterm labor, growth restriction, in part because of less oxygenation to the fetus or the baby. So that's a big reason why we want our future moms to do their darndest to avoid getting COVID, right? None of us want the flu, none of us want to get sick. So that brings me to the ASRM, so the American Society for Reproductive Medicine, American College OBGYN. Remember, all of our American professional societies and European and Asian counterparts are really trying to chime in on this topic. And what we're sort of determining is that if people are low risk for COVID-19, that they may consider proceeding with embryo transfer. A lot of doctors, even doctors like myself, will make sure that we counsel patients, right? We talk to them about the risk of vertical transmission being low. Another thing that we talk about is if you have COVID-19, coronavirus, the novel one, is that bad for the baby, right? And that comes up with the whole Zika thing. Remember, oh my gosh, just a few years ago, it was so sad with all this Zika virus and having major congenital anomalies, right? Like small heads, microcephaly, facial deformations. Like Zika is really scary from a baby point of view. From a COVID-19 point of view, this appears totally different, right? This is a different virus. So from that point of view, it appears to be a lot, let's say, safer, but again, with guarded, with an abundance of caution, I guess we would say. So the idea of proceeding with a transfer, in many senses, is maybe okay, but it's a risk-benefit discussion that you should have with your physicians and things like that. So remember, myself, the team at HRC Fertility, we're here to talk to our patients, and that's what we do every day, right? Where we sort of communicate with them. It's the part of the reason why I would love to meet with you, talk to you further about this, schedule an appointment, and sort of talk fertility. So we talked about that. We talked about being pregnant. Should we proceed with transfer or not? I would definitely work with your doctor. I'm proceeding with transfers in many of our patients, but with people who are well counseled. What about freezing eggs? What about freezing embryos? Because that comes up. As far as we know, the virus doesn't doesn't contract the virus into the germ cells, into the eggs, into the sperm, as far as we know, March 13th, 2020. But remember, the data is really limited. So many clinics around the US, in the East Coast, in New York, here in Los Angeles, are recommending that people preserve their fertility, freeze eggs, freeze embryos, and maybe just take a little bit of a pause. Let this virus sort of run its course, right? Remember, in Asia right now, in China, they've done a wonderful job sort of limiting and trying to contain things, especially over the last month or two. And that containment seems to be helping, because even in China now, things are starting to loosen up. People are starting to go to restaurants, starting to even, I understand, as of a morning report, go to Shanghai Disney. That's starting to open again. So life is starting to get a little more normal there now. So that's what I'm hopeful for in the US. But guys, I was talking to the lead microbiologist at Children's Hospital LA, which is arguably one of our nation's best children's hospitals. And I understand that we're thinking that the US is probably 10, 12 days behind what Italy was. So we're sort of ramping into a high risk period for an outbreak. So the idea of doing all of our preventative measures in a major way. So I'm talking, what are some things that we can do? So hand washing, right? I know we've all heard about it. Oh my gosh. But guys, 20 seconds, sing the happy birthday song, warm, soapy water. If you can't wash your hands, make sure to use hand sanitizer. Make sure it has, greater than 50, 60% of alcohol content. That'll help, ensure good hygiene. Try to avoid, touching surfaces that are highly often touched, door handles, countertops, things like that. The other big thing, and this is what we're doing from a public health point of view, is we're trying to keep spatial distance, right? 2 yards, 6 feet between people. We're also doing other things to, limit exposure. So trying to avoid going to big gatherings. Here in, I think in San Francisco, they limit any gatherings greater than 1,000 people, certain cities less than 250, things like that. So really do your darndest to try to do all the preventative measures. One thing with HRC Fertility, our practice has done an awesome job taking this seriously. So when patients come to our office, everyone's required to check their temperature, right? If people have a fever, we direct them not to the emergency room. We direct them to the public health department because we don't want to infect all these emergency rooms either. We want to keep our health system functioning as best we can. Again, a ton of safety measures here at our practice, here in Rancho Cucamonga, here in Pasadena, and just within HRC in general. Let me talk a little bit about who are the high-risk groups, right? So me as a fertility specialist, remember guys, I take care of reproductive age men and women, right? Reproductive age men and women typically are not in our highest risk groups. So the people who are most at risk are our grandparents, our parents, people who are in their 80s, 70s, 60s, right? People who also have other comorbidities. What the heck is that? So what comorbidities are other major diseases. So respiratory diseases, cardiovascular disease, heart disease, diabetes, those are big risk factors. In Asia, males who had smoked were really, and who are older, those were super high risk people for high mortality rates or high death rates, right? So just putting this in context, what's the mortality rate with COVID-19? So it depends on your age. It depends on your risk factors, right? So people who are over 80, the death rate is 15%, 14.8% in an article published in either JAMA or Lancet, right? 70s, you're in death rates of 8%. In your 60s, death rates of almost 4%. Right? Guys, putting this in context, influenza, the common flu, which, by the way, kills a heck of a lot of people, the mortality rates are 0.1%. Now, please understand, there's going to be some reporting bias. It gets into like complicated epidemiology stuff regarding mortality rates, like did you study all the people in the population and things like that. So from that point of view, this virus has two main things. So two main things is it's highly contagious. So its RO value is really contagious. So that's why we're trying to limit groups. That's why many schools throughout the United States are closing. Here in Los Angeles, many schools have closed for several weeks until we hear further information. Throughout the nation, certain states have closed their schools. And it's not because kids are affected with the same mortality rates that older people are, but it's because they're in a close environment and they can spread this virus very easily. And then they can infect their family, and from their family, their grandparents, and beyond. And we're trying to prevent and tamp down or cool off this new novel coronavirus. So that's part of the reason. So highly contagious, and it's got a higher virulence, higher mortality rate, especially in high risk groups. So I think I touched on a lot of the main things I wanted to. I'm not sure if there's comments from the audience that maybe I can touch on. I hope that helped. Of course, remember, here, myself, Dr. John Norian, we're here to help. I have an upcoming fertility seminar coming up in just a few weeks. And I'm going to be doing a seminar also for our LGBTQ patients coming up. And that gets into more issues related to egg donation, surrogacy, and things like that. And please understand, here at HRC Fertility, we've got an awesome team of wonderful physicians, wonderful nurses, embryologists, and we're taking this stuff super seriously, and we hope you guys do as well. So I'm looking to the moderator for questions. So guys, have a great Friday. It's a wet, rainy day here in Southern California, which I know sounds funny, but it's usually 72 and sunny. But we hope you do well, and be safe, sleep, rest, and quarantine yourself, especially if you have a fever, especially if you have symptoms of coronavirus. If you're thinking about pregnancy, if you're thinking about transfer, and whatnot, make sure to reach out to your doctor. And reach out to the CDC, reach out to our to other websites to keep yourself informed. So all the best, and take care. Best regards from me, John Norian, Dr. Norian, and HRC Fertility.